Okay, welcome back to some fun modalities. Today we're talking about traction. We're going to introduce you guys to our traction table and our dinosaur of a traction machine over here. Talk about all of its finicky ways and what it likes to, or how it likes to be treated as far as when we're setting a patient up. We will also talk about how to set somebody up and get them properly positioned, depending on what we're trying to treat on the table. And then we'll also show you guys, we have a cervical machine, well, a couple of cervical machines. One's really old and looks very archaic. And then we'll talk about some hands-on, more manual type stuff. So our patient today, at least for this one, is going to be our wonderful Craig over here. So first thing, you bring the patient to the table. And you can adjust the height just by stepping on the little pedals here. So you adjust the height of the table. It would be appropriate, easiest for the patient to sit down and get onto the table. This looks like it should be pretty easy for Craig to get onto, so we'll allow him to lie down. We'll start by having him supine, or actually maybe switch around. And so if you notice that there's a little crease right here, that's actually where the separation occurs on this table. And so you want your patients, kind of the top of their iliac crest to be about right there. And, yep, which he's about there.
Did you find it?
Found it. Pretty hard. So next we've got two little braces or harnesses that we want to strap around the patient. And these we're actually going to get pretty tight on them, because
I wore slippery pants today.
he wore slippery pants today, and we want to make sure that it doesn't slip
slippery
off.
shirt.
So we're really going to strap them.
I'm never going to be 5'9" after this.
It's just not going to work today. Sorry, Craig. If anybody's ever ridden a horse and you've been strapping on a saddle, it's kind of like that. You want it to be nice and tight, and so you tug them on there pretty good. Because if we don't get it tight enough, then the harness will move and we won't get any separation. So we want to make sure it's good and tight. Should have asked if our patient had gone to the bathroom before this, but we'll just make sure that he's able to control his bodily functions or his bladder.
I hope so.
We've got two little...
We're running out of hand sanitizer.
We're running out of hand sanitizer. Oh, man. Okay, so we got the bottom one strapped on. We'll get the top one strapped on again. It's going to overlap, at least in the beginning, because as we start to actually get some separation and perform some traction, then those two pieces of the harness will actually separate, and that kind of gives us an idea that we're actually doing what we're supposed to be doing. Depending on what you're wanting to treat, you will have your patient either in a supine position or in a prone position, or if we want to get them into more of a neutral position as far as the spine goes, we can utilize the little stool here. So we'll try and get Craig into a more of a neutral position. So we'll allow him to put his legs up on the stool, and I went underneath the stool. On top of that. Then we've got our little hanger. We're going to hook the hanger onto the lower straps there. The upper straps, they actually come up and wrap around, and there's two little eyelet hooks that we've hooked it onto. We can tighten those up just to make sure that they're not going to have too much slack in them as well. Now the fun part begins as far as our machine goes. So there's a little rope release here. You have to push that back. There's a little arrow. It tells you all, it says push for rope release. So we're going to do that. And that allows us to pull out. If we don't release that, it's not going to allow us to pull that rope out. So you need to pull that out. This machine is pretty finicky as far as if you have too much slack on it and you try and start the machine or start the treatment, it's going to beep at you. So you want to, once you get it hooked on there, pull that release again and take up as much of that slack as you can. Then go ahead and turn that on.